The only long bone in the body with two primary centers of ossification. What is your answer, doctor? We need to remember clavicle. Clavicle has a lot of exceptions. It's the only horizontally placed bone in the body, etc., etc. Yeah. Now, where is the nutrient artery of the humerus? Basically, it is a branch of profunda brachii. So, there are about 7 to 8 locations where nutrient arteries of those bones, they are the branches from there, is a common question, which you have to remember. Now, lesser and greater sciatic foramen. What are the contents? Is a favorite anatomy question from times immemorial. So the tendon of the obturator internus, internal pudendal nerve, and the nerve to obturator internus. These are all the ones which are basically passing through the lesser sciatic foramen. Then in the embryology, neural tube formation is one of the important area. So where does the process of the neural tube formation will be initiated? It is in the cervical, upper cervical area where it will be initiated is what you need to remember. Then anything about the neural crest cell derivatives is a very common question, doctor. All neural, anatomy is a very cruel subject. Too many kutti things we have to remember and go to exam, and some methods of remembering you need to develop. So, modal pass is what is a worldwide way of remembering the neural crest derivatives. M for melanocytes, O for odontoblast, T for tracheal cartilage, G for enterochromatin, L for laryngeal cartilage. Similarly, it is the adrenal medulla, not adrenal cortex, which is the derivative of the neural crest, and you will definitely remember while answering in the exam hall. Neural crest derivatives is a question that is going to come if you are taking AIMS, PGI, All India, State PG, Comet KE, JUPMA, DNB. The 8 exams and Manipal, 9. 9 exams you are going to take down the line in the next 2 months. Definitely 50% of exams you will come across neural crest derivative question. Whenever you are doing skeletal exercise, skeletal muscle need more blood supply. So that is the reason the arteriolar resistance due to the vasodilatation will fall down and preferential blood flow will go to the muscles instead of going to the viscera. That's the point about exercising. Now, how is carbon dioxide basically transported? Predominantly in the form of bicarbonate in the serum. So you must know what is chloride shift, then oxygen dissociation curve, right and left shift. They are all the important issues for the examiner. Normally, if you give secretin in any individual, what happens to the gastrin? Gastrin is basically suppressed. But if it is a gastrinoma, secretin cannot be able to inhibit the gastrin, but administration of secretin stimulates the gastrin production by the gastrinoma. Inability to suppress the gastrin production in spite of giving secretin is an indication that there is a gastrinoma, is what you need to remember. Now, a weightlifter lifted a very heavy weight and suddenly his muscles will give up beyond the point of tension. So, who senses the tension of the weight inside the muscle is a very important question, and that would be Golgi tendon organ. So, what are 1A afferents and what is muscle spindle, right? So, the 2 pages in Genong physiology you have to read today only if you answer this question wrong. And what is that reflex called as? Inverse stretch reflex. Whenever the stretch on the muscle is increased due to a high tension, suddenly it will give up. It will send a negative reflex so that muscle will go into relaxation and you will throw away the weight, which is then called the inverse stretch reflex, is mediated by the Golgi tendon organ. Then if you are taking a lot of glucose, fatty acids, what happens? The duodenal and jejunal mucosal cells called K cells, they basically release gastric inhibitory peptide, and Gastric inhibitory peptide is also called glucose dependent insulinotropic peptide, because it will stimulate the pancreatic insulin secretion whenever you eat a lot. It is this gastric inhibitory peptide which basically goes and stimulates the insulin release. Hence it is also called insulinotropic, glucose dependent insulinotropic substance is the other name which is being given for that. Now doctor, Tay-Sachs disease, what is the underlying problem in these people? Glycolipids are supposed to be broken down. If they are not effectively broken down, then that leads to development of accumulation and development of neurodegenerative disorders, which are the underlying problem in the case of the Tay-Sachs disease is what need to be remembered. So mental retardation, blindness, muscular weakness and mortality by 3 years of age is what you classically come across. Where is vitamin B12 is required? Odd chain fatty acids are there, no? Whenever they get metabolized, what is formed? Even chained fatty acids will release acetyl-CoA, 2-carbon end product. Odd chain fatty acids will release 3-carbon propionic acid. The propionic acid will become propionyl-CoA, right? Propionyl-CoA will become methylmalonyl-CoA, and methylmalonyl-CoA will in turn become succinyl-CoA. Succinyl-CoA enters into citric acid cycle. That is how the ultimate atma of the dead odd chain fatty acid will enter into paradise called citric acid cycle. Any interruption of that, where methylmalonyl-CoA converts into succinyl-CoA, what is that enzyme called? Methylmalonyl-CoA mutase. It has got vitamin B12 as the coenzyme, and any deficiency of vitamin B12 will lead to that methylmalonyl accumulation, leading to methylmalonyl aciduria, which is the underlying problem in case of the vitamin B12 deficiency. So methylmalonyl-CoA to succinyl-CoA conversion require methylmalonyl-CoA mutase, for which vitamin B12 is the coenzyme, is what I want to once more emphatically underscore to you. X-linked ratio disorder, which one it is? Duchenne's muscular dystrophy classically. So today's paper, I personally sat to choose questions, because giving 2 tough questions and defeating your confidence, no point. Giving too easy a paper and inflating your false confidence also is, I will be doing a wrong job. So let us manage to balance the 2 sides so that at least 150 score you should cross in this paper, doctor. Today's paper, if you cross it means don't read. You need not read until entrance. Take it as my word. If you have not crossed even 100 marks in this paper, serious time to think. You have to put Shishasanam, hold your breath and prepare. If you are below 100, that too for February exam, February or March, state MD entrance I am talking about. If you are between 120, 130 in today's paper, good going. Just you need to stretch yourself a little more and you are sure to be into the top Fortune 500 company. First 500 ranks you are bound to get. If you are today 120, 130, you are sure to get a seat, provided you maintain the tempo for next 3-4 months. That's the idea. So from now onwards we will have questions of similar weightage, so that ultimately scores are more or less like the actual entrance. Uronic acid is absent in which scenario? Basically hyaluronic, derman sulfate and chondroitin sulfate, they all contain uronic acid, but keratan sulfate is the only glycosaminoglycan which does not contain the uronic acid, is what you have to basically remember. Which is a quaternary structure out of all this? So, you know, tertiary quaternary structure. Similarly, enzyme kinetics, type of inhibition, competitive, non-competitive inhibition, allosteric inhibition. So, Michaeli-Menton's kinetics, all those important high yield areas you have to chew and swallow, assimilate and reproduce in exam. So, doctor, out of all this, hemoglobin is a tetramer which has got 4 polypeptides, and hemoglobin is the best example of a quaternary structure. How does diphtheria toxin act basically? It basically produces a elongation factor inhibitor. So it inactivates the elongation factor, and that in turn will block the protein synthesis, which is the mechanism of diphtheritic toxin. You want to take Neisseria gonorrhea in a cervical swab, then what is the best medium to do that? Thayer-Martin's medium is composed of chocolate agar and several antibiotics. What will they do? They will suppress all other non-pathogenic Neisseria and only enable the growth of the gonococcus, Neisseria gonorrhea only, and that is the reason we use this Thayer-Martin medium is what you need to remember. Where we use McConkey, gram-negative rods, especially Enterobacteriaceae, E. coli. We basically use McConkey's agar. Now doctor, live attenuated pathogens, if you are using as vaccines, they basically give lifelong immunity. Generally, what is the rule in live attenuated vaccine? One vaccination is enough. Only exception is OPV. So OPV is a live vaccine, we give multiple doses, but in most of the other scenarios, BCG, everything, live attenuated vaccine, it will create a natural immunological memory with the multiplication of organisms, and that remains a extended lifelong immunity is a very important feature. So vaccines is one very high yield topic in two subjects, microbiology, SPM, pediatrics. ये तीनों चीजों में top 10 topic list में है vaccine. So you have to be 100% sure on all vaccines. 49-year-old milkman from Pondicherry. The very occupation that he is a milkman is an important risk factor for Q fever, anthrax. There are certain zoonotic disorders to which he is vulnerable, and he is developing a wound on the forearm and non-hemolytic colonies, gram-positive, non-motile rods with the squared ends. Classical of Bacillus anthracis is what you have to basically remember. Then what is transmitted by spirochetal infection transmitted by arthropod. So what disorders are transmitted by ticks, what by mites? That list is there, no? SPM wala list. वो तो पक्का पढ़ना पड़ेगा, नहीं पढ़े तो like a tick or mite we will be killed by the competitors in the entrance exam. So it is the relapsing fever is what you need to remember. Then coming to viral replication, how does it basically happen? It is a double-stranded RNA genome. You have a positive RNA strand, Saru, both as a mRNA, and also it acts like a template to the complementary negative RNA. That is the nature of the viruses is what you have to basically understand. A patient was given 200 mg and it became 100 mg within the first 2 hours. That means what is the elimination half-life? 2 hours. So it is following first order kinetics. How many half-lives have passed in 6 hours? 3 half-lives. 100 ban gaya, 50, 50 ban gaya, 25, 25 ban gaya, 12.5. So there is a, of course, 100 ban gaya, 50, 50 ban gaya. So 200 is there. No, 200 became 100, 100 became 50, 50 became 25. So that's the reason it becomes 25. If any drug is highly bound to albumin, it remains in the plasma. It can't go into tissues. So the volume of distribution of such a drug will become decreased, is what you need to remember. Such a drug which is highly bound to albumin, is it more dialysable or less dialysable? You can't dialyze such a drug when toxicity occurs because it is highly protein bound. If it is less bound to protein, then it is more easy to dialyze it. Accordingly, which drug toxicities dialysis is useful, which drug toxicities dialysis not useful is one of the favorite question of the examiner. Now doctor, midazolam, why it is very effective as anesthetic? Because the mechanism is the GABA mediated chloride channel conductance is increased by it. Any opening of the sodium channel will cause depolarization. Any opening of the chloride channel will lead to hyperpolarization. Hyperpolarization. Hyperpolarization means slowed conduction. Depolarization is fastened conduction. So that's what it will basically do. Patient is having long QT syndrome. He is having trigeminal neuralgia. So what drugs will precipitate polymorphic ventricular tachycardia? Torsedis depointus in long QT syndrome. The list you have to be very sure. So Dr. Amitriptyline, which is basically what? Tricyclic antidepressant, which has got anticholinergic properties. It also will prolong the long QT and predispose to ventricular tachycardia. So fentanyl, acyclovir, amitriptyline, in fact acyclovir anyway is not useful already when trigeminal neuralgia has already evolved. But amitriptyline you can't use, but gabapentin you can use safely in view of the backdrop of long QT syndrome. Tamiflu, Kannada flu. What are the drugs that you know? Oseltamivir, Janamivir. All these anti-flu drugs, what is their mechanism of action? It is anti-neuraminidase. Anti-neuraminidase drugs, these are all is what need to be remembered. There is a hypersensitivity to metronidazole. He has got pseudomembranous colitis. What do you want to give? Vancomycin is a preferable drug in this given scenario. Did you answer any creative answer for this? Chalo. What were the answers other than vancomycin? Anybody? Just I want to learn. Possibly what would have, was it ufloxacin, anybody? No. Hope it is not clindamycin. Ampicillin is very tempting. Did anybody? I know. Yeah, because as a teacher I also need to know what are your wrong answers. Because as a teacher my job is not to teach what is truth, to reveal what is lies and make you to not fall into the trap of the lies. That is what I need to do as a good teacher. So good students like you should create a good teacher ultimately, by telling what mistakes you are doing and how you are wrongly thinking. Then that is how we improve in our standards of setting a question paper. Which immunoglobulin is found on the mast cell? It is immunoglobulin E which is being found post-infectious glomerulonephritis. What is the difference between this and IgA nephropathy? IgA nephropathy mein hematuria follows within 48 hours after the sore throat. Sympharyngitic hematuria it is called. Whereas after 2 to 3 weeks later after the sore throat hematuria occur if it is PSGN, post-streptococcus glomerulonephritis, which is the fundamental difference between the two. Most cases of the epidemic where the sore throat is happening are all subclinical. Lot of times you ask a patient who has got a smoky urine, when did you get sore throat? He won't remember. So 2-3 weeks back he had a sore throat. That's the point. Then delayed hypersensitivity is typically found if there is a tuberculosis with caseating granulomas is what need to be remembered. Then apoptosis, doctor, after doing this cruel question wrong in the today's paper, even if you have not gone and reviewed the 2 pages on apoptosis, Banks gene, bad gene, pro-apoptotic, anti-apoptotic genes and caspases, the mechanisms you have to review. Because without a question on apoptosis, out of the 6 questions in pathology, paper nahi hoga, if it is AIMS or state entrance. Similarly, 15 questions all India mein, DNB mein, you will definitely have apoptosis question. You have to review. Caspase 8 is the one which induces the apoptosis. And who induces caspase 8? It is the FAS ligand. After binding to FAS ligand, the CD95 self-associates and activates the FAS and initiates the death domain protein called FAD. So FAD will decide whether endometrial cells will shed out or not. Normal regular menstruation is apoptotic process. Involution of uterus in the postpartum period is apoptosis. So for everything apoptosis is important. And very important question asked in the exam, DNA ladder, where do you find? Apoptosis is what you need to remember. Similarly, EPOF1, cytochrome C, they're all the important BCL2, all these important buzzwords in apoptosis, don't forget, doctor. Now, pseudo-palisading, endoneural proliferation, hypercellularity with atypical nuclei. Where will you come across? Glioblastoma multiforme, which is the variant of astrocytoma. What is the ugliest, worst type of a astrocytoma? Glioblastoma multiforme, poorest prognosis of all astrocytomas. Now there are prominent osteoid seams, hyperchromatic nuclei, and paramyxovirus viral particles are found. Paget's disease classically. Paget's can become osteogenic sarcoma? Yes. At one point of time, Paget's become osteogenic sarcoma is what need to be remembered. Now, what is the time limit for exhumation in India? For political scams, or exhumating dead bodies, or taking out the skeleton from almaras, there is no time limit in India. You can commit a financial scam in 2000 and 2400 May. That scam will be suddenly appearing in papers, and posthumously people will be investigated. When they are alive, they don't let investigation. So, no time limit for exhumation to take out the dead body from the burial ground. Bitter almonds is basically cyanide. Aconite poisoning may initially tachycardia will be there, later on bradycardia. When bradycardia is there, you will give atropine. Atropine is vasolytic, so it will induce tachycardia. Then, according to the Indian law, what is a rape? Rape is without any consent, depending upon the age also. Even consent is given, but if the age is not 18, that is also treated to be a rape. But it is vaginal penetration, not any other penetration. Oral or anal penetration is not treated to be rape, with or without consent. What is that treated as? Unnatural offences it come under. And unnatural offences are punishable under the IPC 377 is what you have to basically remember. So what is an ecbolic? Ecbolic is the one which increases the uterine contractions is what you need to basically remember. Then local transmission, if you can stop the disease, you call elimination. Global transmission you stop and completely remove the organism, that becomes eradication. Cognitive domain of learning, how can you basically achieve? Weekend crash courses are example of, are they really improving our cognitive ability? They are only increasing our buttifying ability, right? So, entrance has nothing to do with cognition. It is only related to what? Your stickability of the gluteals onto the reading room table and chair. So, that is the one most important parameter that decides. Stability, availability, inertia. Newton's first law is important for getting seat in MD, not the second law or third law. Right? गए तो बैठना पढ़ना फटाफट रिवीजन करना, जो unnecessary है छोड़ देना, जो necessary है पकड़ना. So that is all what you need to do. So that's the thing about cognitive domain. Who introduced multi-purpose scheme? Where he converted unipurpose into multi-purpose health worker. Kartar or Srivastav? Kartar. How much is the daily water requirement of a person? 180 is the golden figure. Problem village is which village? After you get in MS General Surgery and MD General Medicine also, suddenly all these things will come into dream. What was the problem village? Problem village. Suddenly your friend will say, no, you are doing night duty in EMD, Emergency Medicine Department. So forget about your problem village, septic latrine depth, sand particle size, all those things you forget. So you remember dopamine dose, dobutamine dose, isoprenoline dose, new things you will start until then. So doctor, distance of the water source more than 1.5 kilometers is treated to be the problem village. There are certain definitions for that. The 10 babies born and every baby is 2.8, there is no difference between one baby and the other baby. Then what is the standard deviation? 0 is what you need to remember. A population study was done and the mean value was 86. If the sample of 100 showing normal distribution, what percentage will be above or below 86? Mean is always the middle value. So 50% this side, 50% that side. Then histogram basically is what? It is used basically to plot a frequency polygon. Histogram mein all the peak points are all joined and that's how you get the frequency polygon is what need to be understood. What is a strong sewage? What is a weak sewage? What is the basis? So doctor, biological oxygen demand and suspended solids both are more than 500 mg per liter is a definition of a strong sewage, which you have to read to ultimately become a cardiologist. Now, standard error, where is it utilized? To know the group variability, we use what is called as the standard error. What is the purpose of phase 1 trial? Phase 1 trial where you want to know the toxicity profile. That's the main idea of doing phase 1. Similarly, for what will you do? Efficacy, etc., different levels of the drug trials. What is their purpose is a favorite question of the examiner. Cold chain system. So vaccines cannot be stored at subcentral all the way up to 1 month. Power cuts will be there. Totally refrigerator will be taken away by the medical officer because there is a party in the home. So lot of things can occur at subcentral level, right? ANM के बेटे का engagement function है. So what she will say, अच्छा फ्रिज यहाँ इधर उधर क्यों हमारे सब सेंटर का लगाओ, एक ऑटो लाओ और फ्रिज को लगाओ, फंक्शन के बाद लाएंगे क्या? What is mistake? What is wrong? Anything is for the purpose of usage only, no doctor, she will say. So you must be quite sure. Now you are asked to provide a evaluation of a football team. Recently one Indian player also while doing a somersault kick had died. Indian football player. A recent news also. Very recent news. So commonly football में मरने वाले लोगों का क्या होता है? दो चीज होते हैं, MVP और HOCM. Both of them, why will they die? In MVP or HOCM they have a predisposition for ventricular fibrillation. Ventricular fibrillation. So sudden onset of ventricular fibrillation will kill them before somebody can resuscitate. So that is the reason any obstructive hypertrophic cardiomyopathy, HOCM and MVP, you have to be careful and prevent them from participating in competitive sports is what you need to basically remember. In hyperkalemia, what do you see? A tall peak T wave. What do you see in hyperkalemia? U wave and increased amplitude and width of P wave, prolongation of PR interval. You will surely remember me in exam hall. Hypokalemia, calcemia, bacteremia, ECG changes. 100% you should be sure. One question jarur aayega, any entrance you go. Now, coming to the cardiac murmurs, what features suggest that this particular murmur is benign murmur, innocent murmur? There are certain important parameters. What suggests it is pathological? Any congenital malformation and murmur, pathological. Tachypnea and murmur, pathological. Abnormal pulses like bounding pulse, etc. if you find, along with murmur, pathological. Precordial bulge, displaced beat, apex. Presence of the trill, abnormally fixed sound, or any diastolic murmur is pathological. Systolic can be innocent, but not always. And if it is a systolic, pansystolic also is pathological. Pansystolic can also be pathological. But if it is a systolic murmur, short in duration, which is soft in nature, if it is musical, then or if it is usually heard along the left sternal edge, then that is also suggestive that it is innocent or functional. So I leave the literature for you about which type of murmur. Ductus arteriosus, ductus venosus, what is their function in embryology? Cardiac embryology, how the heart develops. Ductus venosus, what will it do? It will shunt the blood from the umbilical vein into the inferior vena cava. That is what it will do. Most of the blood in the heart, will it be able to enter into pulmonary artery? No. It will try to enter into aorta and systemic circulation in the embryonic life, right? Now, Yagon side appearance, where do you find? There are totally 14 appearances, doctor. There are two ways of learning it. Why they appear like that, वो पूरा पढ़ के याद रखना एक चीज होता है. दूसरा, कैसे भी उसको याद रखना. End point is to remember whatever it is, underlying cause. Second way, depends on what you want to do, but you have to. Yagon side is uncorrected transposition of the great vessels. If transposition of great vessels occur, normally, can you give me the, because cardiology is not SPM, and without logic reason, learning, reviewing cardiology and that to eye teaching like that is not, is inappropriate. So, can you give me the, yeah, 1 minute. Yeah. See, doctor, you have the heart. Now, from the heart, who is originating? From the left ventricle, aorta is originating. Aorta will become aortic arch and become descending aorta. So, whenever you see the plain X-ray, you are having the cardiac shadow, and here you are having a aortic knuckle because of this aorta which is having the curvature. Transposition of great vessels में क्या हो जाता? Aorta जाके right ventricle में open हो जाता. And pulmonary artery originates from the left ventricle. Because of that, what happens to the aorta originating from right ventricle? Right ventricle is like, what kind of right ventricle it is? Right ventricle is that so much loving, soft mom. Left ventricle is like a tough dad. So suddenly tough dad चले जाके soft mom के हाथों में आ गया aorta. So it won't show that bulge. And hence if you take an X-ray, what happens normally aortic, here you have apex of the heart in the X-ray. Then you are having what? That aortic bulge. That bulge is obliterated, right? And because of that obliteration of the bulge and a globular shaped heart, how the heart will look like? It is hanging at the end of a string. Normally, the cardiac shadow, if you take, you will have aorta causing a shadow. Then you have a hilar shadow, then you have apex shadow in the plain X-ray. So this becomes like a straight one, like a string, and the heart looks like a egg hanging on to the end of a string. So that is what you see in transposition of great vessels, when there is a loss of the aortic arch shadow, and that makes the base of the heart become thin like a string. That is what you need to basically understand. Okay, doctor?